Today, we're going to have the most uncomfortable medical conversation of your life, and almost certainly the one that will save you from disaster. From the age of 70, your doctor will start ordering a barrage of routine tests. They'll tell you it's prevention. They'll tell you it's simply the protocol. But here's the chilling truth the system hides. The same tests designed to save you at 50 can physically destroy you at 75. And 91% of doctors will never explain to you that the risk far outweighs the benefit. Overdiagnosis. Toxic treatments for abnormalities that would never have killed you. Irreversible surgeries. Today, I'm going to reveal the 5 routine medical tests you should question and reject immediately if you want to protect your quality of life. Number 1 medical test to question: the prostate-specific antigen test, known as PSA. For decades, men have been taught that this simple blood draw is their shield against prostate cancer. And at age 50, it is. But if you're over 75, this little tube of blood is a direct gateway to a clinical nightmare. The U.S. Preventive Services Task Force itself explicitly warns doctors to stop performing this test on older men. Why does your doctor keep ordering it at your annual checkup? To understand the deception, you must understand the biology of aging. Prostate cancer in men over 70 is, in the vast majority of cases, extremely inactive. It's so slow that oncologists have a saying for it: you're more likely to die with prostate cancer than from it. If you're 78, a microscopic cancer could take 20 years to cause your first symptom. Your body will simply shut down naturally long before that prostate becomes a real problem. But here's where the trap is set. As the prostate ages and naturally enlarges, your PSA levels rise. Your doctor sees the elevated number and goes into a protocol panic. He orders a biopsy. A biopsy isn't a massage. It involves dozens of needles piercing your tissue to reach the prostate. In a 75-year-old body, this triggers severe pain, heavy bleeding, and most terrifyingly, a very high risk of sepsis and hospitalization due to bacterial infections.
And if you survive the biopsy without infection, they'll tell you you have cancer. The medical machine kicks into gear. They'll push you onto the operating table or into weeks of radiation. The reward for curing a cancer that wasn't going to kill you? The irreversible side effects of surgery. Permanent urinary incontinence, forcing you to wear diapers for the rest of your life, and total erectile dysfunction. They mutilate you to save you from a phantom threat.
Don't take my word for it. Take the facts. A landmark study published in JAMA followed 76,000 men. The conclusion was brutal. PSA testing in men over 70 offered absolutely zero mortality benefit. No one was spared. But the harm from overdiagnosis and overtreatment was massive. The next time you see PSA on your lab order and you're over 75, take a pen and cross it out.
Exhibit number 2, the routine colonoscopy. Listen carefully. At 50, a colonoscopy is a miracle of preventative medicine. It saves lives by blocking cancer before it even begins. But the medical system makes a fatal error. It assumes your body at 75 can handle the same things it did at 50. If you've had normal colonoscopies in the past, and your doctor requires another one after 75, just for routine, they're pushing you to play Russian roulette with your bowel.
The problem isn't the camera, it's your anatomy. Over the decades, the wall of your colon changes. What was once thick, elastic tissue becomes thin, fragile, and rigid, like parchment paper. Now, imagine a gastroenterologist pushing a 5-foot-long rigid tube through that fragile tissue, inflating it with pressurized air to get a view. In an elderly patient, the force required to navigate the curves of the colon is a recipe for mechanical disaster.
The problem isn't the camera, it's your anatomy.
Over the decades, the wall of your colon changes. What was once thick, elastic tissue becomes thin, fragile, and rigid, like parchment paper. Now, imagine a gastroenterologist pushing a 5-foot-long, rigid tube through that fragile tissue, inflating it with pressurized air to get a view. In an elderly patient, the force required to navigate the curves of the colon is a recipe for mechanical disaster. The rate of serious complications in patients over 75 is 3 to 4 times higher than in younger patients. We're talking about the risk of perforation, making an actual hole in your intestine that spills bacteria into your abdomen, causing peritonitis and requiring emergency surgery. We're talking about uncontrollable bleeding if they try to remove a polyp. And that's not to mention the massive stress that general anesthesia and heavy sedatives put on an 80-year-old heart and brain.
The American College of Physicians is unequivocal. They recommend against screening colonoscopies in adults over 75 with average risk. The medical math is simple. At this age, the probability of developing a new aggressive colon cancer that shortens your life is extremely low. However, the probability of dying or being left with permanent damage from a complication of the procedure is frighteningly high. The risk is not worth the reward.
Test number 3. Routine mammograms after age 75. Women have been taught for decades that skipping a mammogram is a death sentence. And for a 50-year-old woman, that scan is her best friend. But crossing the 75-year mark transforms this brilliant prevention tool into the most dangerous overdiagnosis machine in the medical system. Continuing to look for shadows at this age is opening a door you should never cross.
Just as with the prostate in men, breast tissue and the biology of the disease change radically with age. If a woman develops breast cancer at 80, in the overwhelming majority of cases, we're talking about an indolent tumor, a nodule with such extraordinarily slow growth that it would never spread or cause a visible symptom in her lifetime. But mammography, with its millimeter resolution, finds that tiny, harmless spot. And once the system sees it, the protocol can't ignore it. That's when the real terror begins. They call you to the clinic, injecting a level of anxiety and panic that robs you of sleep. They subject you to painful biopsies, only to confirm a cancer that wasn't actually a threat. But the treatment machine doesn't stop. They push your frail 80-year-old body into invasive, excising surgeries. They subject you to weeks of debilitating radiation that burns your tissues and drains your energy. In some cases, they prescribe chemotherapy. The medical system poisons and mutilates you to eradicate a mirage.
The scientific evidence is devastating. A massive study published in JAMA Internal Medicine evaluated women over 75 and showed that detecting and treating these tumors did not improve their survival by a single day. It did not extend their lives. All this aggressive medical intervention did was ruin their later years, filling them with post-operative pain, chronic fatigue, anesthesia complications, and massive psychological stress.
If medical treatment destroys your golden years before the disease itself, it's not prevention, it's negligence.
Test number 4. Constant monitoring and aggressive glucose control in frail, older adults. Throughout your adult life, you've been terrified of high blood sugar. Your doctor obsessively pursues keeping your glycated hemoglobin test, the famous HbA1c, rigidly below 7.0%. To achieve this, they prescribe 1, 2, even 3 different pills, forcing your metabolism to reach that perfect number. But in a 75 or 80-year-old patient, this obsessive, chemically induced pursuit of numerical perfection is, quite literally, a death trap.
When you force an aging body to drastically lower its sugar level with cocktails of medications, the result isn't health, it's a blackout. This leads to severe hypoglycemia. Your blood glucose level plummets abruptly and unnaturally, robbing your brain of its primary fuel. You begin to sweat profusely, your vision blurs, and profound mental confusion takes hold in your own home.
The medical treatment that was supposed to protect your kidneys or eyes 10 years down the line is collapsing your nervous system in a matter of minutes.
And this is where aggressive control takes its worst toll. In that state of extreme dizziness induced by the pills, you fall. And at 80, a fall means a fractured hip, the complete loss of your independence, and a prolonged hospital stay. Multiple studies now show that aggressively lowering glucose in frail elderly people increases the mortality rate. It doesn't decrease it. It's so dangerous that the American Diabetes Association itself now requires much more relaxed targets for older adults, accepting levels between 7.5 and 8.5. Tell your doctor to stop prescribing you as if you were 40.
Test number 5. Routine extensive CT and PET scans. Many doctors order CT or PET scans for elderly patients under the guise of just a general checkup to look for cancer. Listen carefully. Subjecting an aging body to massive doses of clinical radiation without a specific serious symptom is not preventative medicine. It's outright negligence. You are voluntarily walking into a machine designed to find problems where none exist.
The real danger of these scanners isn't just the radiation, it's their extreme sensitivity. These machines almost always detect what we call incidental findings, small abnormalities, harmless cysts, shadows, or benign nodules that you've probably lived with peacefully for decades and that would never affect your life expectancy. But here's the deadly trap. Once the medical machine sees that harmless shadow on the screen, blind protocol compels them to investigate it.
The real danger of these scanners isn't just the radiation. It's their extreme sensitivity. These machines almost always detect what we call incidental findings. Small abnormalities, harmless cysts, shadows, or nodules that you've probably lived with peacefully for decades and that would never affect your life expectancy. But here's the deadly trap. Once the medical machine sees that harmless shadow on the screen, blind protocol compels them to investigate it. Suddenly, because of a harmless shadow, you're thrust into a cascade of terror. You're subjected to invasive biopsies, exploratory surgeries, and general anesthesia. A landmark study in JAMA Internal Medicine revealed the terrifying truth. Pursuing these incidental findings in older people led to serious complications in 23% of cases. The survival benefit? 0. 0 days added to your life.
You're being cut open, mutilated, and risked with a deadly infection simply to satisfy the curiosity of a machine. To truly understand the magnitude of this systemic negligence, we have to put aside the charts and statistics and look into the eyes of the real victims. Let me tell you Thomas's story. Thomas came to my office 5 years ago. He was 78 years old at the time. He was a vibrant, lucid man who enjoyed long daily walks and playing with his grandchildren. His only mistake was attending his annual checkup and blindly trusting his primary care physician's protocol. Without asking him any questions about his quality of life or his priorities, his doctor ordered a full battery of blood tests, including the PSA test for the prostate. He simply ticked a box on a form. The results came back, and Thomas's PSA was slightly elevated. What Thomas's doctor didn't explain to him is that at 78, a naturally enlarged prostate almost always raises this marker. Instead, medical alarm bells rang.
He was urgently referred to a urologist who immediately, following the blind protocol of defensive medicine, scheduled a biopsy. Prostate.
Thomas wasn't warned of the true danger. The biopsy introduced bacteria directly into his bloodstream. 3 days after the procedure, Thomas wasn't strolling through the park. He was in the emergency room with a raging fever and uncontrollable shaking. He had developed sepsis, a massive and life-threatening bacterial infection caused by the medical intervention itself. He spent a full week hospitalized, receiving broad-spectrum intravenous antibiotics that wiped out his immune system and left him physically ravaged.
And then came the biopsy results. Prostate cancer. The urologist, looking only at the paper and not the frail man in front of him, recommended scheduling immediate surgery to remove the entire prostate. He told him they had to act fast. It was in that moment of utter terror that Thomas's family contacted me for a second opinion.
When I sat down with Thomas, I did what every geriatrician should do: biological math. I assessed his cardiovascular health, his medical history, and his overall vitality. I calculated that, optimistically, the Hopium Thomas's realistic life expectancy was about 8 to 10 years. Then I reviewed the pathology of his tumor. It was an extremely low-grade cancer. A cancer so slow that statistically it would take 15 to 20 years to even peek outside the prostate gland and cause him the slightest symptom.
I spoke to him bluntly. I said, "Thomas, if you have this surgery today, you're going to spend the last 8 years of your life wearing adult diapers because of guaranteed incontinence. You'll suffer from complete erectile dysfunction, and you run the risk of not waking up from the general anesthesia. All this to remove a tumor that was never, ever going to shorten your life." I recommended the only ethical course of action at his age: active surveillance. Do absolutely nothing but observe. Thomas canceled the surgery.
Today, Thomas is 83 years old. He still walks in the park. He maintains his dignity, his continence, and his quality of life. And that dreaded prostate cancer hasn't progressed 1 iota, millimeter. Had Thomas blindly followed the inertia of the medical system, that preventive protocol would have completely destroyed his golden years, turning him into a chronic patient, suffering from a treatment he never needed.
Thomas's story is not an anomaly. It's the silent norm in hospitals around the world. I've seen hundreds of elderly patients physically and psychologically broken by tests and treatments that, from a purely scientific standpoint, should never have been authorized. The modern medical system is terrified of lawsuits and obsessed with data. That's why they're programmed to search for disease at all costs, without pausing to consider whether finding that disease will actually benefit the patient in front of them. But you're not a data set. You're the CEO of your own body, and it's time you started acting like it. Just because a doctor, no matter how prestigious, writes an order on a prescription pad doesn't mean you have to extend your arm or sign a consent form. The doctor's order is a recommendation, not a mandatory sentence. especially when independent medical evidence shows that the test could do you more harm than the disease itself.
Before you even agree to have your blood drawn for a tumor marker, or before you put on a hospital gown for any scan or procedure. If you're over 70 and want invasive procedures, you must demand that your doctor look you in the eye and answer these 3 non-negotiable questions. Question number 1. Doctor, realistically, based on my age, pre-existing conditions, and overall health, what is my current life expectancy? If the honest answer is less than 10 years, the vast majority of routine cancer screenings are clinically inappropriate. Don't let them look for problems that extend beyond your biological timeline.
Question number 2. If we do this test and do indeed find an abnormality, what would the exact treatment be, and what are the actual risks of that treatment for a body my age? If the treatment involves high-risk surgeries, extreme toxicity, or the loss of your daily independence, then the initial test isn't worth the risk of opening that door.
And question number 3, the most important of all. Doctor, what does the current medical evidence show that's specific to people my age, not young or middle-aged adults? Demand clinical evidence, not just a rehash of the standard hospital protocol.
I guarantee that asking these 3 questions will completely change the dynamic in the waiting room. Some doctors will be uncomfortable because it disrupts their routine of 15-minute visits. But doctors who truly care about your longevity and well-being will respect your level of information.
You have the absolute right to be an informed patient. You have the right to make medical decisions based on your life priorities, preserving your peace of mind and protecting your body from aggressive and unnecessary medical interventions.
The quality of your golden years doesn't depend solely on the wonders modern medicine can perform. Often it vitally depends on knowing exactly which medical interventions to say no to.
If this information has opened your eyes and you refuse to be another victim of blind protocol, subscribe to this channel right now. We need to build a community of patients who demand clinical truth, unfiltered and free from corporate interests. Go to the comments and tell me, what medical test has your doctor pressured you to have recently? What will you decide now?
I'm Dr. Anya. Defend your health with knowledge, protect your body with courage, and I'll see you at our next appointment.